Hi y'all, welcome to another installment of Champaign County Healthcare Consumers Healthcare Fact Chat. I'm Claudia Lennhoff. I'm the Executive Director of Champaign County Healthcare Consumers, and I am joined by
Adani Sanchez, Client Services Coordinator at Healthcare Consumers.
And today, what we want to talk about is Representative Rodney Davis did an interview on CNN a little while ago. What was the date on that?
So June 27th on CNN.
June 27th on CNN, and he said some pretty interesting things about healthcare, and so this is our response to some of the things that he said.
Yeah, he was responding to a fellow colleague in the House of Representatives who had said that people will die as a result of the Senate healthcare bill and the devastating cuts on Medicaid, and he had a pretty serious response to that. And he kind of said that he called it a hateful and vitriolic rhetoric, which is really funny and interesting.
So the fact of this congresswoman saying that she was fearful that people would die because they would lose their health insurance, he called that hateful, vitriolic rhetoric. First of all, I think it's important to define vitriolic. That means it's filled with bitter criticism or malice. Not unlike the Senate's health care bill, but actually, she was not speaking in hyperbole or vitriol. And in fact, the New England Journal of Medicine came out with a study, or published a study recently, June 21st, 2017, that talks about the effects of health insurance on health and survival. And then they conclude in the study that there's strong evidence that expansions in health coverage have increased people's use of health care and have reduced deaths overall. And one of the things that I know from many years ago is that the Institute of Medicine came out with this massive study years ago that basically said that people who are uninsured, because they lack health insurance and therefore lack timely access to health care, die younger, they live sicker, and they essentially die from treatable and preventable diseases. And so we know how important it is to have health insurance. So the Congresswoman was not using hyperbole at all. This is factual. So the study that was published in the New England Journal of Medicine basically also went on to say that gaining Medicaid cuts mortality by 6% over 5 years, with the biggest gains coming from treatable conditions. And I think we feel like we see that in our clients, right? People with heart disease, cancer, infection, they have an opportunity to be diagnosed in a timely way and treated, and these are all things that can lead to death if they go on too long untreated. One of the other things that it said that I think it's really important for people to know is that overall, for every 300 to 800 adults who get coverage, one life is saved per year. So we have easily enrolled several thousand people in this community.
Right.
So several lives in this community have already been saved simply by virtue of gaining coverage. They also had to say that the longer that people have coverage, the greater is the reduction in mortality. So more coverage over more time is better for you. You tend to have better survival over health
Because you're
care
getting
issues.
that treatment.
Exactly.
Because you're getting that care on a regular basis. You're maintaining.
Yeah. So I think that it's really unfortunate that Rodney Davis refused to really engage on the issue of what actually happens to people when they lose health coverage. All of us who do consumer health advocacy or work in healthcare know absolutely that coverage saves lives because it becomes people's passport to care. So that's all I'll say about that. What else did he have to say in this interview?
He also made some interesting things. He started talking about Medicaid in Illinois, and he said some things that just really weren't making a lot of sense to me. Like, I don't know why he was saying those things. Can you talk a little bit about what he was talking about with Medicaid?
Well, I think he was trying to say, as if it's a problem, that's, Illinois is a Medicaid expansion state, which has been great, right? Because people who previously couldn't qualify for Medicaid, even though they were low income, could now get coverage under Medicaid. And I think Rodney Davis was trying to frame it as problematic that 44% of the people in Illinois with expanded Medicaid are between the ages of 19 and 34. And when he said that, I thought, yeah, and what's the problem? That means that the Medicaid expansion is working exactly as it's supposed to, and I don't have any problem with 44% of people with expanded Medicaid being in those age categories. In fact, adults who get Medicaid, well, the other thing that he said is he also insinuated that these people were unemployed and that they ought to get jobs and get their health care through their jobs. And so that is really chock full of misconceptions about who has Medicaid coverage through the expansion and also whether they're working or not. And so I wanted to just clarify that actually virtually all of the adults who have the expanded Medicaid do not have employer-based health insurance, not because they're not working, but because they're working jobs that do not offer employer-based health insurance. Some of them are self-employed and small, business owners who just don't make enough to have a commercial health plan. And essentially, the expanded Medicaid is working exactly how it was designed to work. Most people who do get that coverage are actually employed, and then one of the things that I just wanted to point out is if anybody goes out to eat to a restaurant, or you go to a bar, or you go and get your hair cut, or you go and fill up your gas tank at a gas station, a lot of those employees who you're interacting with do not get health insurance through their employer. And a lot of times they are lower wage workers who now are benefiting by through the expanded Medicaid. And so Representative Davis needs to check himself on some of these facts. And then lastly, just to contrast his statements with actually the bill that he voted for in the House and the bill that he seems to be supporting in the Senate. The Senate bill, for example, gets rid of the employer mandate. That's a requirement that employers of a certain size offer health insurance to their employees. So on the one hand, he's deriding people who need to use the expanded Medicaid and telling them to go get jobs that offer benefits, while also not saying that he's actually supporting bills that would reduce employer-based coverage. So people who have jobs, may lose their coverage through their jobs. It's just, I really have a problem that he has positioned himself to be a mouthpiece, for these bills, and that he is speaking poorly of his constituents and doesn't understand the circumstances of their lives, and actually also doesn't understand the policies that currently benefit them, yet is so cavalier in his willingness to take away those benefits.
Yeah, I wonder how deliberate his confusion is. I'm not sure. I'm starting to wonder because he also talks about, just following, he talks about how there are still a whole bunch of people without health care, and there are even more people who have health care and they can't afford to use it, but he's still supporting this bill that makes all of these things worse.
Right.
That takes away care from people and increases costs for people who still have health care, whether it's through their employer or through the health insurance market.
Right. So if his critique of the Affordable Care Act is that there are still millions without insurance and millions who can't afford the cost of their care with that insurance, the answer is not to vote for legislation that would actually make the problem much, much worse. But just to also clarify some of his comments, there are millions without insurance even under the Affordable Care Act, but in fact, a huge proportion of those are people who live in states like our home state of Texas that chose not to do the Medicaid expansion.
Right, which he's complaining about earlier.
Exactly, yeah. And those are low-income people who would not, be able to easily afford a marketplace plan, but do not have the option of getting expanded Medicaid. And, the reality is that the bills that have been proposed in the House and in the Senate would make the problem worse by at least 22 more million people. And then the other thing that I find very disingenuous is Rodney Davis conflates the uninsured numbers with the numbers of people who get health insurance through the marketplace but can't afford, the deductibles or the increase in the cost of premiums. And in fact, I think it's something like 80% of people who get their insurance through the marketplace get some kind of financial assistance under the Affordable Care Act. That would be made much, much worse under the American Health Care Act or under BICRA in the Senate. So, it's just really unfortunate. What else? There's something new happening too, though, right? There's a cruise amendment.
Yeah, so there's a new cruise amendment being talked about being added to the Senate healthcare bill. This cruise amendment is a way to offer freedom and flexibility to insurers that will give people more options. And so what this cruise amendment says is health insurance companies can offer non-ACA compliant plans on the marketplace if they offer at least one federally qualified healthcare plan that fully meets all the requirements and rules. So as long as they have that one plan, they can offer these other plans that maybe don't have all the essential health benefits covered, or maybe they have like really, really high deductibles and don't meet the actuarial value standards. Right. So it's this really weird way of getting insurers into the market, but also dividing up the risk pool for this individual market, because who are going to be the people that sign up for that full, complete healthcare plan?
So it'll be people like me who have pre-existing conditions and are concerned about, making sure that my healthcare costs are going to be covered, and so I would be much more attracted to an ACA compliant plan.
Right.
And then who would be, so then an insurance company could sell basically junk insurance, right? Insurance that looks like insurance but really isn't insurance because it doesn't cover a lot of things, but those policies would be cheaper. They could sell those, but then people who have pre-existing conditions are more likely to stay with the ACA compliant plans. And then what would happen to the cost of our plans if sicker people or people with pre-existing conditions are segregated into those plans versus the other ones?
So all those costs are going to go up because all of those sick people, you're using more healthcare as it is. So if you don't have enough healthy people who are paying into those premiums and paying into those pools, but not using the healthcare and helping offset the cost of the sicker people who are using the healthcare, that means all your prices are going to go up at a faster rate because you're using that healthcare, you're paying into it, and then you're using it, and then it's pushing up costs.
So what problem is this cruise amendment supposed to solve?
We don't know.
This is what happens when people who don't understand health policy, don't care really about health policy, are making health policy. And so stay tuned. I think we'll close up by saying that it's really, really important that people do not let up on your activism to oppose the Senate health care bill, known as the Better Care Reconciliation Act. And then now here's this cruise amendment. A CBO score will be coming out soon on that, and there could be a vote as early as next week. And it's really important to not let up on the activism. And we'll be sending out emails letting people know exactly what they can do to help fight this. And just in summary, that Senate health bill, we can summarize it this way: making money for millionaires by murdering Medicaid. But I suppose that's hyperbole and vitriol, except for that it's true. So that concludes this healthcare fact chat. Thank you.